Hello, my name is Caleb Barrow, and I'm a fourth-year medical student at NASM. Today I will be presenting the following research project titled Epidemiology of Invasive Haemophilus influenzae disease in Northeastern Ontario. I've been working on this project with fellow medical student Rachel Belanger, as well as Dr. Tara Barron and Dr. Marina Ulanova. Disclosure of affiliations, financial and in-kind support. I have no disclosures to make. Introduction. Haemophilus influenzae is a gram-negative coccobacillus that is part of the normal flora of the upper respiratory tract. Based on its polysaccharide capsule, it is classified into different serotypes, each denoted by a letter, such as serotype A and B. There is also a non-typable Haemophilus influenzae, which does not possess a polysaccharide capsule. Before the rollout of the Haemophilus influenzae type B vaccine, type B was the leading cause of meningitis, epiglottitis, and invasive disease in children. In the post-vaccine era, non-typable Haemophilus influenzae has become the predominant cause of invasive disease worldwide, along with type A in northern indigenous pediatric populations. Previous research by our group showed that in the hospitalized patients in northwestern Ontario with invasive Haemophilus influenzae disease, 41% had type A and 50% had non-typable Haemophilus influenzae. Many of the type A cases were in non-indigenous adults. This is in contrast with previous research showing serotype A to typically affect indigenous children in northern regions such as Alaska and Nunavut. Objectives: to study the epidemiology of invasive Haemophilus influenzae disease in northeastern Ontario, which has not been previously done, as well as to compare with our findings from northwestern Ontario. Methods: we retrospectively reviewed cases of invasive Haemophilus influenzae disease admitted to the main catchment hospital for northeastern Ontario, which is Health Sciences North in Sudbury, from April 2014 to March 2022. Results: a total of 15 cases of invasive Haemophilus influenzae disease were identified, with 20% involving Indigenous patients. Patients' ages range from 25 to 90 years, with a median of 74. 11 patients were female and 4 were male. Serotype distribution was the following. 13 cases had non-typable Haemophilus influenzae, with 1 case of type A and 1 case of type F. For clinical presentation, 11 cases presented with pneumonia, 2 with meningitis, 1 with ovarian abscess, and 1 with septic arthritis. In terms of isolation sites for Haemophilus influenzae in the body, 12 patients had Haemophilus influenzae isolated from their blood, 2 from the CSF, 1 from the pleural fluid, 1 from synovial fluid, and 1 from peritoneal fluid. Many patients also had significant comorbidities, with 10 patients having cardiovascular disease, 6 with diabetes, 4 with chronic kidney disease, 3 with COPD, 3 with malignancy, and 1 with immunodeficiency. One isolate of non-typable Haemophilus influenzae was found to be beta-lactamase positive. Out of the 15 cases, 3 proved to be fatal, and they were all caused by non-typable Haemophilus influenzae. Discussion and conclusion. Despite the fact that non-typable Haemophilus influenzae lacks a protective polysaccharide capsule, it has developed many other virulence factors, which has allowed it to become the dominant serotype to cause invasive Haemophilus influenzae disease worldwide. Our study confirmed that non-typable Haemophilus influenzae was the predominant serotype that caused invasive disease in northeastern Ontario. This finding is particularly noteworthy when contrasted with northwestern Ontario, where a higher share of type A was found to cause invasive disease in both Indigenous and non-Indigenous populations. This highlights a significant difference in serotype distribution between western and eastern northern Ontario, which indicates that different strategies are necessary to reduce invasive Haemophilus influenzae diseases in these regions. Most patients with invasive disease in northeastern Ontario were older adults with a significant number of predisposing comorbidities. Our study would suggest that prioritizing the development of a non-typable Haemophilus influenzae vaccine for older adults would be the most effective strategy for fighting invasive Haemophilus influenzae disease in northeastern Ontario. Thank you for listening.